Many men assume that waking up several times during the night to urinate is simply a normal part of getting older. It is often treated as an inconvenience, something to tolerate rather than something to examine. Conversations about prostate health frequently begin only after symptoms become disruptive enough to interfere with sleep, daily routines, or overall comfort. However, clinical observations and medical research suggest that nighttime urination, often referred to in medical literature as nocturia, can sometimes reflect changes occurring in the lower urinary tract, including the bladder and prostate. These changes do not appear suddenly. In most cases, they develop gradually over time as physiological processes evolve with age. For men over the age of 60, the prostate gland commonly undergoes structural changes associated with hormonal regulation and cellular growth patterns. These changes may influence urinary flow and bladder function. While such developments are widely documented in medical literature, they are often misunderstood or overlooked in everyday discussions about men's health. The important question is not simply why nighttime urination happens, but what it may indicate about the body's regulatory systems. Research published in peer-reviewed urology and endocrinology journals suggests that factors such as hydration patterns, metabolic health, inflammatory processes, and hormonal signaling may all play roles in prostate-related urinary symptoms. Understanding these connections does not immediately provide a solution, but it does change the perspective. Instead of viewing these symptoms as an unavoidable consequence of aging, they can be understood as part of a broader physiological process, one that modern medical research continues to study in detail. Discussions about prostate health often begin with a simplified assumption that urinary symptoms in older men are an unavoidable consequence of aging. Many men interpret frequent nighttime urination, a weaker urinary stream, or the feeling of incomplete bladder emptying as natural milestones of getting older. Because these symptoms tend to develop gradually, they are often accepted rather than investigated. This perception is reinforced by the fact that prostate enlargement, medically known as benign prostatic hyperplasia, BPH, becomes more common with age. Medical literature consistently reports that structural changes in the prostate gland occur in a large proportion of men later in life. As a result, it is easy to assume that symptoms related to these changes are inevitable. However, the reality is more nuanced. While age-related prostate growth is common, the severity of symptoms varies widely among individuals. Some men experience noticeable urinary difficulties, while others with similar prostate enlargement may have few or no symptoms at all. This variability suggests that multiple physiological factors, not age alone, contribute to how symptoms develop. Another common misunderstanding involves the relationship between prostate enlargement and prostate cancer. These conditions are biologically distinct. Benign prostatic hyperplasia is a non-cancerous enlargement of the prostate that affects urinary function, while prostate cancer involves malignant cellular changes within prostate tissue. Although both conditions occur in the same organ and become more prevalent with age, they arise from different biological processes. Confusion also persists because public conversations about prostate health often focus on symptoms rather than underlying mechanisms. Media discussions sometimes present isolated health tips or lifestyle claims without clearly explaining the scientific context behind them. As a result, men may receive fragmented information that lacks clear connections to established medical evidence. Recognizing these misconceptions is an important step toward understanding prostate health more accurately. Instead of viewing urinary symptoms solely through the lens of aging, medical research increasingly examines how metabolic health, hormonal balance, inflammatory pathways, and lifestyle patterns interact with prostate physiology. This broader perspective allows for a more evidence-based understanding of why symptoms occur and how they may be addressed within a preventive health framework. Understanding prostate-related urinary symptoms requires grounding the discussion in established medical research. A large body of epidemiological data, clinical trials, and observational studies has examined how prostate conditions develop and how they affect men as they age. One of the most widely studied conditions is benign prostatic hyperplasia, BPH, a non-cancerous enlargement of the prostate gland. According to the National Institutes of Health, BPH is among the most common urological conditions affecting older men. Population studies cited by the NIH indicate that histological evidence of prostate enlargement is present in approximately 50% of men by age 60 and increases with advancing age. However, the presence of prostate enlargement does not necessarily mean that symptoms will occur, which highlights the complexity of the condition. Research summarized by the Centers for Disease Control and Prevention also emphasizes that lower urinary tract symptoms, including frequent urination, difficulty starting urination, and nocturia, can arise from multiple physiological causes. These include bladder function changes, prostate enlargement, and neurological or metabolic influences that affect urinary regulation. Several peer-reviewed studies have also examined lifestyle and metabolic factors associated with prostate health. For example, research published in the journal Diabetes Care has explored the relationship between metabolic health and urinary symptoms. Observational findings suggest that insulin resistance and metabolic syndrome may be associated with increased inflammation and changes in prostate tissue growth patterns. Because observational studies identify correlations rather than direct causation, researchers emphasize the need for additional controlled clinical trials to clarify these relationships. Hydration patterns have also been examined in urological research. Studies reported in the Journal of Urology have investigated how fluid intake timing may influence nighttime urination frequency. Some clinical observations indicate that excessive fluid intake late in the evening may contribute to nocturia in certain individuals. However, these findings are generally considered supportive observations rather than definitive treatment recommendations, and they are typically interpreted alongside broader lifestyle and medical assessments. Another area of research has examined prostate cancer risk factors. Long-term cohort studies, including research conducted by scientists at Harvard T.H. Chan School of Public Health, have explored associations between reproductive health patterns and prostate cancer incidence. One widely cited observational study followed more than 30,000 men for nearly 2 decades and reported statistical associations between ejaculation frequency and prostate cancer risk. Importantly, the authors of that study emphasized that such findings reflect correlations observed in population data and do not establish direct cause and effect relationships. International health organizations continue to study prostate conditions because of their significant global impact. Reports from the World Health Organization highlight that prostate diseases, including both benign conditions and cancer, represent major components of men's health worldwide. As a result, ongoing research focuses not only on treatment approaches, but also on prevention strategies and early detection methods. Taken together, the current body of evidence suggests that prostate health is influenced by multiple interacting factors. Age remains one component, but metabolic health, inflammation, hormonal regulation, and lifestyle patterns also appear to play roles. While research continues to evolve, these findings provide an evidence-based foundation for understanding how prostate-related symptoms may develop and why they vary significantly among individuals. To understand why urinary symptoms can emerge in later life, it helps to examine how the prostate interacts with several biological systems in the body. The prostate is a small gland located below the bladder and surrounding part of the urethra, the tube that carries urine out of the body. Although the gland itself is relatively small, its position within the urinary system means that even subtle structural or functional changes can influence how urine flows from the bladder. One of the most significant biological influences on the prostate involves the endocrine system, particularly male hormones known as androgens. Testosterone, produced primarily in the testes, circulates throughout the body and supports many physiological functions. Within prostate tissue, testosterone is converted by an enzyme called 5-alpha reductase into a more biologically active form known as dihydrotestosterone, or DHT. According to research published in peer-reviewed urology and endocrinology journals, DHT plays a central role in regulating the growth and maintenance of prostate cells. Over time, cellular responses to hormonal signaling may lead to gradual tissue growth in the prostate. This process contributes to benign prostatic hyperplasia, where both stromal and epithelial cells within the prostate begin to proliferate. Importantly, this growth pattern is considered non-cancerous and occurs in many men as they age. However, because the urethra passes directly through the prostate gland, even modest increases in tissue volume may place pressure on the urethral channel. When this occurs, the urinary system compensates in several ways. The bladder muscle, known as the detrusor muscle, may begin contracting with greater force in order to push urine through a partially narrowed urethral passage. Initially, these compensatory adjustments can maintain relatively normal urination. Over time, however, increased bladder workload may contribute to symptoms such as urgency, incomplete emptying, or more frequent urination. Inflammation is another biological factor that researchers increasingly examine in relation to prostate function. Chronic low-grade inflammation has been observed in prostate tissue samples collected during clinical evaluations for benign prostatic hyperplasia. Studies suggest that inflammatory signaling molecules, known as cytokines, may influence cellular growth patterns, immune activity, and tissue remodeling within the prostate. These inflammatory processes can arise from multiple sources, including metabolic disturbances, oxidative stress, or immune responses within the tissue. Metabolic health appears to interact with these mechanisms as well. Research examining the relationship between metabolic syndrome, characterized by insulin resistance, elevated blood glucose, and altered lipid profiles, and prostate conditions has identified possible connections between systemic metabolic regulation and prostate growth patterns. Scientists continue to study how insulin signaling pathways and inflammatory mediators may influence prostate cell behavior. Although these relationships are still being investigated, they illustrate how prostate physiology may reflect broader metabolic processes occurring throughout the body. Neurological regulation also contributes to urinary function. The process of urination involves coordinated signaling between the bladder, the urethral sphincter, and the nervous system. Sensory nerves within the bladder wall detect changes in bladder volume and send signals to the brain indicating fullness. At the appropriate time, the brain sends signals back to initiate bladder contraction while relaxing the urethral sphincter. When prostate enlargement alters urinary flow, this coordination may become more complex. The bladder may signal fullness earlier or more frequently if it cannot empty completely. This incomplete emptying can result in residual urine remaining in the bladder after urination, which may contribute to the sensation of needing to urinate again sooner than expected. Age-related changes in sleep regulation may also influence nighttime urination. Hormonal regulation of fluid balance, particularly the release of antidiuretic hormone during sleep, normally reduces urine production overnight. Changes in this regulatory pattern can increase nighttime urine production in some individuals, adding another factor to nocturia. Taken together, these mechanisms demonstrate that prostate-related urinary symptoms rarely arise from a single cause. Instead, they reflect the interaction of endocrine signaling, tissue growth patterns, inflammatory pathways, metabolic regulation, and neurological control of bladder function. Medical research continues to examine how these systems interact and why symptoms develop in some individuals while remaining minimal in others. Understanding these mechanisms provides an important biological context for interpreting urinary symptoms in later life. Changes in prostate function and urinary patterns can influence daily life in ways that extend beyond the urinary system itself. While symptoms such as increased urinary frequency, urgency, or nighttime urination are often discussed in isolation, researchers increasingly examine how these changes interact with broader aspects of health, including sleep quality, metabolic regulation, and long-term functional well-being. One area that has received considerable attention is sleep. Frequent nighttime urination can interrupt normal sleep cycles, particularly the deeper stages of restorative sleep that occur later in the night. Sleep researchers have noted that repeated awakenings may affect overall sleep efficiency, which refers to the amount of time spent asleep relative to time spent in bed. Over long periods, reduced sleep quality can influence daytime alertness, cognitive performance, and general energy levels. In addition to sleep-related effects, lower urinary tract symptoms associated with prostate enlargement may influence daily activities and quality of life. Some individuals report needing to plan travel, social activities, or work schedules around access to restroom facilities. While these adjustments are manageable for many people, they can contribute to subtle changes in routine or independence over time. From a clinical perspective, untreated urinary obstruction caused by prostate enlargement may, in certain cases, place additional strain on the bladder. Urological research has shown that persistent obstruction can lead to structural changes in the bladder muscle as it works harder to expel urine. In more advanced situations, incomplete bladder emptying may increase the likelihood of urinary tract infections or bladder stones. However, such outcomes vary widely and do not occur in all individuals with prostate enlargement. Public health researchers also emphasize that prostate health is closely connected with broader physiological systems. Conditions such as metabolic syndrome, cardiovascular disease, and chronic inflammation have been studied for their potential associations with prostate-related symptoms. While these relationships are still being investigated, they suggest that prostate health may reflect overall systemic health rather than functioning in isolation. Importantly, many prostate-related conditions develop slowly over time. This gradual progression creates opportunities for early monitoring, preventive health strategies, and informed conversations with healthcare professionals. By understanding how prostate health fits within the broader landscape of aging and systemic health, individuals can make decisions that support both long-term health span and day-to-day well-being. Medical guidance on prostate health is based on a combination of long-term epidemiological data, clinical trials, and expert consensus developed by professional medical organizations. These guidelines aim to provide evidence-based recommendations while recognizing that individual health circumstances can vary. Organizations such as the World Health Organization and the National Institutes of Health emphasize the importance of early awareness and routine medical evaluation when urinary symptoms appear. Their public health materials highlight that lower urinary tract symptoms, including frequent urination, urgency, and nocturia, should be discussed with healthcare professionals, particularly for men over the age of 50 or 60. Clinical practice guidelines from the American Urological Association provide one of the most widely referenced frameworks for managing benign prostatic hyperplasia. These guidelines recommend a stepwise evaluation that may include symptom questionnaires, physical examination, and laboratory testing when appropriate. The goal is to determine the severity of symptoms and identify whether medical monitoring, lifestyle adjustments, or medical treatment may be appropriate. There is strong professional agreement among urologists that prostate-related symptoms should be evaluated within a broader health context. Many clinical guidelines encourage physicians to consider metabolic health, medication use, fluid intake patterns, and neurological factors when assessing urinary symptoms. This comprehensive approach reflects the understanding that urinary function is influenced by multiple physiological systems. At the same time, certain areas of prostate research remain under active scientific investigation. For example, researchers continue to explore how metabolic syndrome, chronic inflammation, and lifestyle factors may influence prostate growth patterns. While observational studies have suggested potential associations, experts emphasize that additional controlled research is required before firm clinical conclusions can be drawn. Finally, most major medical organizations agree on the importance of prostate cancer screening discussions between patients and healthcare providers. Decisions about screening methods, such as prostate-specific antigen (PSA) testing, are typically made through shared decision-making that considers age, family history, and individual risk factors. Overall, the current medical consensus highlights a balanced approach. Careful monitoring, open communication with healthcare professionals, and evidence-based decision-making guided by established clinical guidelines. Translating medical knowledge into everyday life requires a cautious and responsible approach. While scientific research provides valuable insights into prostate physiology and urinary health, public health guidance typically focuses on general health practices rather than individualized treatment strategies. Many health authorities emphasize the importance of maintaining overall metabolic health as part of supporting urinary and prostate function. Regular physical activity, balanced nutrition, and adequate sleep are widely recognized components of long-term health. Although these factors influence many organ systems simultaneously, researchers continue to study how they may also interact with prostate physiology and urinary symptoms. Fluid intake patterns are another area frequently discussed in clinical settings. Healthcare professionals often advise patients to maintain consistent hydration throughout the day while being mindful of fluid intake later in the evening if nighttime urination becomes disruptive. However, individual needs vary depending on factors such as medication use, kidney function, and cardiovascular health, which is why personal guidance from a healthcare provider remains important. Routine medical checkups are also a central element of preventive care. For men in middle age and beyond, physicians may recommend periodic evaluation of urinary symptoms and discussions about prostate health during primary care visits. These conversations allow healthcare professionals to assess potential risk factors, review relevant family history, and determine whether further evaluation is appropriate. Importantly, responsible health communication avoids promising outcomes or offering generalized solutions for complex biological conditions. Instead, public health guidance focuses on informed awareness and open communication with qualified healthcare professionals. Individuals experiencing persistent urinary symptoms, significant sleep disruption, or noticeable changes in urinary patterns are encouraged to discuss these concerns with their healthcare providers. Such discussions allow medical decisions to be made based on individual health status, clinical evaluation, and evidence-based medical guidance. Understanding prostate health requires looking beyond isolated symptoms and considering how multiple biological systems interact over time. The prostate, although relatively small, plays an important role within the urinary and reproductive systems. Changes affecting this gland can reflect broader physiological processes involving hormones, metabolism, inflammation, and neurological regulation. Research over the past several decades has significantly improved the medical community's understanding of these processes. Scientists continue to study how age-related changes, lifestyle patterns, and systemic health factors influence prostate function. This expanding body of knowledge allows both physicians and patients to approach prostate health with greater clarity and evidence-based guidance. Equally important is recognizing that many prostate-related conditions develop gradually. This slow progression provides opportunities for awareness, monitoring, and early discussion with healthcare professionals. Regular medical consultations, attention to overall health, and informed decision-making remain key elements of long-term well-being. By approaching prostate health through a balanced, evidence-based perspective, individuals can move beyond uncertainty and toward informed awareness. Knowledge does not eliminate every health risk, but it allows people to better understand the signals their bodies provide and to seek appropriate medical guidance when needed. This content is intended for general educational purposes only and does not constitute medical advice, diagnosis, or treatment. The information presented is based on publicly available research and guidance from recognized health organizations, but it should not replace consultation with a qualified healthcare professional. Individual health conditions vary, and symptoms related to urinary function or prostate health may have multiple causes that require professional evaluation. If you are experiencing persistent urinary symptoms, sleep disturbances related to nighttime urination, or other health concerns, you should consult a licensed physician or healthcare provider for personalized medical assessment. Do not disregard professional medical advice or delay seeking medical care based on information presented in this content. Decisions regarding screening, diagnostic testing, or treatment should always be made in consultation with a qualified healthcare professional who understands your individual medical history and health status. For accurate medical guidance tailored to your specific needs, please consult your healthcare provider.